With Donald Trump as the president-elect and the Affordable Care Act in jeopardy, how will that affect the state's budget? We'll talk to the woman in charge of Medicaid next on the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. We have a new president coming into office, and with the new president, there will be a new cabinet. How will they deal with the Affordable Care Act? Will Obamacare, as it's commonly called, still be around? And if it is around, what will it look like? That is of top concern to states across the country, and a top concern of Secretary of Department of Health and Social Services in Delaware, Rita Landgraf. I would imagine, thank you for being here, by the way.
Thank you for having me.
I would imagine you're watching very carefully for any signs of what's going to happen. What have you been able to tell so far?
Well, it's still rather early. There is definitely messaging that we are paying attention to. We know, especially the Republicans have always indicated their concerns over the Affordable Care Act and repealing the Affordable Care Act. We know the newly appointed Secretary of Health and Human Services, Tom Price, indeed is a physician himself and has always voiced concerns about the Affordable Care Act. So we do believe that it will change over time. But what we are seeing, we're in our fourth enrollment relative to the insurance marketplace. And as we're watching those numbers, both nationally and here locally, we are actually gaining much momentum, more so than any other enrollment that we've had in the past. So if you think about what the public, their behavior is such that they still recognize this is federal law and that we are mandated to have health insurance.
So you're a fan of the Affordable Care Act?
I am. I believe that we can always improve upon it. I believe it's good public policy that we actually have and are addressing healthcare policy. We haven't done that as a country since the 1960s when Medicaid and Medicare were developed. So it's been a long time that our country hasn't advanced in a health policy type of a framework. So from that perspective, I believe that has really opened the doors for people to gain insurance. Delaware's uninsured rate is actually the lowest it has ever been. We estimate right now we have about 54,000 Delawareans without health insurance, and that's the individuals that we're trying to market right now as we are in our fourth enrollment under the marketplace. We actually had an event down at the University of Delaware at the Star campus, and I heard 30 people enrolled yesterday to get the younger generation enrolled, and of course they can stay on their parents' insurance.
And you must be encouraged, on that point, you must be encouraged, if you are a fan of the Affordable Care Act, that President-elect Trump said on 60 Minutes, oh, no, I want to keep that, keeping the children up till 26, and then also saying he wanted to keep the fact that pre-existing conditions would be mandatory. So that's not some of the things he said in the campaign. It seems like his position on the Affordable Care Act is evolving.
I think it is. I think it's going to be very difficult to completely roll it back or completely repeal it. So I think, Congress will also have to look at what can we do. My hope is that we'll continue to improve upon that. In Delaware, we also have benefited from the expansion of the Medicaid program. So we're very hopeful that we will continue to get the support and subsidies as well on our marketplace in order to help make that insurance affordable.
Certainty must be very difficult, especially when you're putting a budget together and you're not sure what money you're going to need where and what services are going to be needed.
That's quite accurate, but I don't believe that things can happen rapidly. They never seem to happen rapidly if it took us from the 1960s until 2010 to actually address health policy. But indeed, it is still very concerning. Our team is looking at that. If they were to no longer support states with the expanded Medicaid population, that would mean $100 million more put onto the state budget if we wanted to cover that population. So indeed, fiscally, we have to stay very vigilant and really analyze any changes that occur in Washington.
Say it can't happen quickly, but Paul Ryan has said, and Mitch McConnell has both said, it's a priority. So if anything's going to happen quickly, the repeal's going to happen quickly. You just did put in for your budget.
I did.
And you put in for what, a 3% increase?
I did.
And what are you looking at in the budget this year?
Well, we actually did a couple things. We put in for that 3% increase, and a lot of that is within my Medicaid program and, the cost of Medicaid. We do have to address, especially here in Delaware, the cost of health care. And we are doing that with stakeholders across the healthcare system because we do know that that cost is not sustainable. And you see that cost filtering into your premiums as well when you look at insurance. So I'm very confident that at least in Delaware, we have the right thought leaders across the table that are in the insurance market, that are in the healthcare delivery system, to really focus on how do we provide quality health support to our citizens to increase our outcomes from a health perspective. And we know if we really promote those healthy outcomes, if we really embrace prevention and supportive populations, that indeed then they won't have to go to a higher level of cost of care because they have chronic disease.
Politics is always a worrisome thing when you're talking about this. And I know we've been talking about federal politics, but you now have a state Senate. We don't know what the balance of power in the Senate's going to be. For the first time since 1973, the Republicans may take control of the Delaware Senate. Does that affect you in the budget process? Is that something you have to be cognizant of?
The legislative branch is very important to the executive branch from a public policy standpoint, but absolutely also from a budgetary standpoint. The governor, for instance, proposes his budget, but it's really the legislative branch that comes up with that law.
I don't envy you at all. I tell you why I don't envy you. I mean, I understand what you're saying. You're going to do what you can do, and you can't determine what's going to happen at the federal level. You can't determine what's going to happen in the Senate. But there is so much uncertainty. There is so much uncertainty out there that you are putting together a budget almost blindly. I mean, you know what you need.
Yes.
You just don't know what's going to be there.
Yes, and we have to stay vigilant.
Yeah, well, God bless you. And thank you so much.
Thank
I appreciate you being here. Secretary of the Department of Health and Social Services in Delaware, Rita Landgraf. When we come back, if you haven't explored Delaware, you should. And there is a new app and a new guide coming out that will tell you about when the Delaware Way continues.